Hey there everybody, I'm Dr. Christina Hibbert, and today I want to talk to you about something that has been so helpful for me personally, and especially as I've tried to help my clients better understand their emotional health. Now, this is a model that works not only for women, which is really who I'm speaking to today, but also for men to understand our mental and emotional health and how our brain, our hormones, and our life experiences all combine to either create and improve our mental health or to try to bring it down, right? Now, if you haven't already, go ahead and check out the Women's Moods series I have. It's a 3-part series on my website, drchristinahibbert.com, and I talk there about this connection between our brain, hormones, and life experiences, which to me are the 3 core elements of women's mental health. And men's mental health too. It's just that men don't tend to have those huge hormone shifts every month that women have once they begin their menstrual cycle and throughout their life until menopause. So hormones are a huge factor in women's mental and emotional health. They're also a factor in men's mental and emotional health, but again, they don't have those huge shifts like we do that we can count on or not count on every single month, right? So be sure to check that out. The link is below, or go and type in Women's Moods on my website. Now, I'm doing this because somebody actually emailed and asked, hey, you mentioned this in a talk that you were giving, and I want to understand this earthquake model of women's mental health or mental health. And I realized I had not ever done anything about this on my website, even though I might have mentioned it. I did, however, write about this in my book, 8 Keys to Mental Health Through Exercise. So if you have that book, or if you want to get that, then great. You can also go to exerciseformentalhealth.com and download an earthquake assessment chart to use for yourself or with clients if you are a mental health practitioner. And you can also find a link to that right below this video. Now, today we're going to talk about this, the earthquake model of mental health. And the first time I learned about this was really from the book Women's Moods by Sichel and Driscoll. Fabulous book that helped me understand this link between, or begin to understand, I guess, this link between our brain and hormones and life experiences. And I've since adapted their model to use in my own different way with my own clients and with myself. So today I'm going to teach you a little bit about this model, and hopefully what you'll find is that this helps you, number one, better understand what is going on with me. Now, I know that I'm not the only one who has felt like you sometimes, have these times of your life where you're like, wow, what just happened? I was totally fine, and all of a sudden I'm super depressed. Or I've had no energy, or I am just so anxious all the time. I can't seem to calm down. And it feels like it came out of nowhere. This can help us understand that. Or perhaps you're someone who, like me, like I have been in the past, are considering, at that point of considering, what do I need to do to get my mental health really under control? Perhaps you've been trying some alternative methods and maybe you need to try some therapy. Perhaps you've been doing therapy for a long time and you need to consider maybe some medication to help along those lines. So I have been there. I understand how you're feeling, and I understand how your clients may be feeling for those who are practitioners. And this is really helpful in that. It can help you understand, first of all, and second, decide what you need to do then to take better care of yourself and your mental health. So here's how it works. This is what I call the earthquake assessment chart. And it's pretty simple. This is just something I drew up here. Again, you can go download one for yourself. But we have here these lines. Down at the bottom is our age, whatever age we are when these things happen. Next is life experiences. So any kind of events in our life that are difficult, challenging, traumatic, that are a loss, that are painful, heartache, anything like that, that stands out in your mind, can be put on this life experiences chart. And you might want to check out my other video on doing a loss timeline to help you understand the losses and traumas and experiences you've had if you're having a hard time understanding that, or realizing and recognizing what you've been through and validating that for yourself. That can be very helpful too. There's a link for that below as well. So our life experiences, which are your life experiences, and only you have to think that they are significant, no one else does, okay? Hormones. So any hormonal events, starting your period when you're young, menstrual cycle, any kind of significant PMS or premenstrual dysphoric disorder, PMDD, anytime you're pregnant or are going through those kind of hormone changes in postpartum, and then into perimenopause and menopause as well. So any hormonal shifts. And then this is the line that shows us what our brain's doing and how our brain might be reacting to these other experiences. And this is just a model, but it really does help us visualize what's going on in the body. So I'm going to use myself as an example. I always use myself because, first of all, I give permission and I know myself. And second of all, I've had a lot of life experiences and hormonal experiences to show you why this is so helpful. And it's really helped me understand my life better. So first of all, just start plotting wherever you want to start. You might have had a significant life experience that was first on your chart. Maybe it's a hormonal event when you start your menstrual cycle, and then we see what it does to the brain chemistry. So I'm going to start, at age 10, my grandfather died, which was the first experience I had with death. Now, it wasn't the most traumatic experience, but it was a significant loss for me. And so here's a significant life experience. And my brain chemistry just changed a little. I forgot this. This top line here is how, and actually I'm gonna draw another line here because it'll fit a little bit better. But this is our outward appearance. Okay, so this is kind of how do things seem on the outside. Do we seem depressed? Do we seem like we're having trouble? Or is everything just kind of seem copacetic, right? So in this experience, nothing really changed on the outward appearance, but with every significant life event and every significant hormonal shift, your brain is going to shift. We literally have a different brain now than we had when we were young, and it has been changing over time with our hormones and life experiences. And if you think about it, here's the whole model. Okay, so if you think about it, think about an earthquake. And before the earthquake happens, what is happening underneath the ground? Right, it is shifting. So there are tremors, maybe little shifts, and we don't feel it. So the outward appearance of the ground and the area might seem normal, but underneath, things are happening and shifting and changing. The same thing happens in our brain when we have even some significant life event or hormonal shift, even if it doesn't feel like it's a huge life-altering kind of experience, our brain responds to that because our hormones are directly linked to our brain and our life experiences directly impact the brain as well. And again, go check out my series, Women's Moods, to understand more about why and how that happens. But let's just say it happens, okay? And sometimes the changes are just little and nothing changes on the outside. And sometimes, eventually, these changes can add up, like the tremors and shifts under the earth, and boom, we have an earthquake, like depression or anxiety disorder or something like that. So at age 10, here's that. Then at age 12, I start my period. So we have some hormones and a little shift again, but again, no PMS, no outward experience, just the normal craziness of being a teenager or becoming a teenager, right? Then at age 15, my mother was diagnosed with cancer, breast cancer, and I thought, being the oldest of 6, that she was gonna die and I was gonna have to not go to college and stay home and raise my siblings and be their mother. And I really did have to do a lot of care for them during that time, but that's what my 15-year-old mind thought. And so that was another shift. But again, no significant depression. My mother went into remission and has actually had 2 other bouts of breast cancer and gone into remission with both of those as well and still living. But that was a significant event. Okay, you see how the brain is changing. At 16, my youngest sister was diagnosed with cancer, stage 4. She was 6 years old at the time, and at 18, when she was 8 years old, she died. My youngest sister died of cancer of the kidneys. And that was my first little earthquake, which to me at the time was significant grief and loss. And I went to counseling because I didn't know about this, but I did know that I was not right. I was grinding my teeth at night and had all these toothaches, and I thought I needed a root canal or something. And my dad's a dentist, and he said, well, go to another dentist, because I was away at college. He said, go to a dentist and see what's really going on before you fly home for me to do your dental work. And I went and got checked out, and he said, have you had any significant stress in your life? And I said, well, my sister died 2 months ago. Does that count? 18-year-old me. And he's like, yeah, that counts. You've been clenching your jaw and grinding your teeth at night, and it's causing this pain. You don't actually need a root canal. So that was good, but it also showed me, okay, I think I need some counseling. So I did go in for grief counseling at the College Counseling Center. Okay, but with counseling and medication and alternative methods that can help us with our mental health, that earthquake can come back down, okay? So it doesn't ever go back to total normal, but with that kind of treatment and care and sleep and nutrition and all of these things that are really good for us, our brain does heal. Okay, that's the good news. We don't stay in an earthquake state forever. It's like a crisis mode, and then we come back if we do what we need to do. But yes, it is possible to stay in the crisis mode for years if we don't take care of ourselves. And that's why one reason why this is so powerful, because it is a sign, it's a way to show ourselves or clients or those that we love what might be going on and why we might need some help and why we might need to just, reach out and receive that help. So if this comes back down to 18, so then at 21, I got married, and at 22, which I'm just putting that there. It was a life experience, and yes, it was stressful, but it wasn't a major event. But I do think I had a little tremor. I feel like I had a little bit of a hard time when I got married. It was a hard adjustment for me. And I think I was a little bit depressed, kind of, but I wasn't majorly depressed, but it was just a huge shift in how I was living. And then at 22, I had my first baby, which, let's just say, all of these hormones experiences, the whole year of being pregnant and then having a baby. And you can see my brain was already kind of up here, had been piled on with a lot of stuff already, and boom, postpartum depression, okay? So you can see how your life experiences and hormones affect your brain chemistry and how you get primed almost for an event, a major earthquake in your life. Sometimes it's more of a minor earthquake, sometimes it's just a tremor, like something that isn't maybe a diagnosis of something, but is a hard time. And sometimes it's definitely a major earthquake. And postpartum depression for me was a major earthquake. We ended up moving in with my parents, living on their floor for 3 months while my poor husband was trying to go to school and work and take care of me. And my mother and father helped take care of us and our baby. And I just was floored. I mean, I did not know what was going on. I thought it was depression. I tried to reach out for help and was told, well, it's probably the baby blues. No big deal. This is what my doctor told me, and sent me a pamphlet on the baby blues in the mail. So then I thought, okay, I'm just a terrible mother. I don't love this the way that I should. And what is wrong with me? Even though I was totally infatuated with my little baby, it was a really hard adjustment. And I didn't go to therapy because I was told that, you should be fine and this is no big deal. And so it took a long time through exercise and lots of prayer and faith and letting people help me and realizing the power of sleep and doing some self-therapy and treatment and talking to friends and support people that I was able to finally get back to more of a normal place. And then, at 24 and a half, I had a second baby. And postpartum depression again. Okay, so you can see how you're primed for these things and how you can come back to these, more normal states where your outward appearance is fine again and you seem well and you are well, but how these things pile up, and then let's just fast forward. I had, a few more babies and other life experiences and hormonal events, and I had some depression in college that felt like it came out of nowhere. But of course, I'm doing my dissertation. I have 2 little kids, and no wonder I might feel depressed while I'm trying to do graduate school, right? And then, when my sister and brother-in-law died in 2007 and I was 32, and suddenly we inherited 2 kids, and that was, the major earthquake that took a really, really long time to overcome. I had just had a baby, our 4th. We inherited our 2 nephews. We went from 3 to 6 kids. I was grief-stricken. They were grief-stricken. We were all traumatized because it was so sudden, losing my sister and her husband. And we just were trying to figure out how to make this new family work. And I was determined to make this new family work and be the mom I wanted to be. But I was also grief-stricken and traumatized and had depression and anxiety and postpartum and who knows what else, right? And I tried everything for a year. I tried everything. I went to therapy faithfully. I took my kids with me to family therapy. I was exercising as much as I could to try to get my body back and feel better, but also really for my mind, again, that exercise mental health link. I was trying to eat healthy, but of course that, we know how that goes. And trying to, get some rest and sleep and let people help me. I even started trying things like, I tried, what's it called? Homeopathy. I went to homeopathy. I went to my doctors and, to make sure that my health was right, that my hormones were right, that my thyroid was right. And after a year of doing all this, we ended up having to go to court to try to adopt the kids, and the grandparents were trying to stop us. And if you want to know more about this story, read my book, This Is How We Grow, because it's quite a story. But needless to say, it was a really, really rough year. And at the end of the year, here we were in court, and court is the worst. So anybody that has to deal with going to court, especially for your own children, to try to make sure that you can keep them, I feel for you. And I started to realize maybe I need something more, like medication. That was the first time I really, really considered medication. But my mother had been on medication because she struggles with chronic depression. And I used to say, I will never go on Prozac because my mom always, would tell me, you need Prozac or you need medication because, you're depressed. And I thought, no, I'm not, and no, I won't, and I never will. But this helped me. This chart helped me at that time, because when I really plotted it all out, and I had all of it on here, I could see, holy cow, my brain has been hammered. And especially in that year, it had been hammered over and over. And no wonder my brain is so out of whack. No wonder the therapy isn't working the way that it did in the past when I went to grief counseling or when I went to other kinds of therapy in graduate school when I was feeling depressed. No wonder I feel like I need something else. And I've tried everything else, and you know what? Maybe it's time to consider a medication, which is the first time I went on an antidepressant, anti-anxiety, and it really helped get me through that time of adopting our kids, which we did finally do. And again, brought this brain chemistry back to a more normal rate. Now, the other things that might be on here too, any kind of brain injury experience. I was also a couple years ago, 3 years ago, rear-ended, and didn't realize, even though I knew I had whiplash, that was a brain injury. And then the next year, almost exactly a year later, I fell and had a significant concussion and actually was in bed flat out for about 2 months, and then really couldn't work and do things the way that I wanted to for a good 8 months. And it's been a long road of recovery. My brain is still not the same because I had one brain injury that really messed up my brain with my concussion, but I didn't realize that before that car accident was another brain injury. So making sure that you understand anytime you've actually had a direct incident to your brain, that definitely can mess up the brain chemistry. In fact, concussions actually lead to symptoms of depression and anxiety, and can lead to major changes in mental and emotional health. And it's really important to identify those things as well. So hopefully this makes sense why we might have earthquakes and why sometimes it feels like, whoa, that came out of nowhere. But when you sit down with somebody and you do something like this, then they start to go, oh, no wonder I'm depressed right now. It feels like I should be fine. But maybe, this little thing that just happened that to me feels like it wasn't even that big of a deal. Maybe it was just the thing that would set off an earthquake because my brain has been just coping, just hanging in there for all these years, and now, bam, it's all set off, right? So remember all those shifts and changes that can be going on because of our hormones, because of our life experiences in our brain, and that those over time can build and build and build. And if we don't know that they're there, or if we don't recognize that, hey, this was a major trauma, like, at 10 and 12 and 15 years old, I didn't realize those were a big deal. Even when my sister died at 18, it was a very different experience than when my other sister died when I was 32. So we can begin to understand these things, learn these things, and that can help us to understand our own emotional and mental well-being. I hope this has been helpful. Be sure to keep coming back here to drchristinahibbert.com for more on this and other crazy, important topics that can help you in your emotional, mental, spiritual, physical, social well-being to overcome, become, and flourish. Bye, everybody.